Do you or someone you know suffer from a binge eating disorder? Binge eating disorder is defined as recurring episodes of eating a significant amount of food in a short period of time, feeling a lack of control while eating when not hungry, and often feeling guilt, embarrassment, or disgust after eating. This disorder is associated with marked distress and occurs on average at least once a week for over 3 months. A number of psychological issues can contribute to binge eating disorder. When you have binge eating disorder, you may act impulsively and feel you can't control your behavior. You may have a history of depression or substance abuse, and you may have trouble coping with stress, worry, anger, and boredom. This is Joe.
I never thought that I would be diagnosed with a binge eating disorder. It's hard sometimes, just after a freaking football game, when we lose to a shitty team for reasons that are out of my control. The only way that I can cope with it is to just go home. It's not even to drink. It's to go home and eat pizza, and eat ice cream, and eat sandwiches, and eat everything that's bad for me, that does not help my body, that does not benefit my body. I don't understand why I do these things. I feel guilty at times. I feel hurt at times after the fact. My body is sore, and I just want to reject everything.
You're much more likely to have a binge eating disorder if your parents or siblings have or had a binge eating disorder. Some people with binge eating disorder may have inherited genes that make them more susceptible to developing the disorder, or their brain chemicals may have changed. This is Hiram.
Lately, I've been feeling really depressed.
I think I got it from my dad. He was always down on himself and just been rubbing off on me, and lately I feel like I can't go outside anymore. I thought it would go away, but I just feel like it's never ending. My mom always told me a good meal would make the pain go away, but lately it just hasn't been going away. I've been having to eat more and more, and I can't satisfy my hunger. It doesn't really help that my mom has Mexican food at the house all the time. I catch myself eating a bunch, and honestly after I feel really guilty because I know I'm not eating normally anymore. I just really want this depression to go away, but I feel like eating is the only way to get through it.
Many people with binge eating disorder have a history of dieting. Some have dieted to excess, dating back to childhood. Dieting may trigger an urge to binge eat, especially if you have low self-esteem and symptoms of depression. This is Sarah.
I've been dieting since I was 10. I had my first diet pill at 15. I've briefly tried exercising and eating healthy, but it doesn't work for me. Nothing works. Every single diet fails. I don't think I have the willpower that it takes to follow through, and sometimes it'll start off well enough. I'll open the fridge and eat a banana, but then I'll open the fridge again, and I'll open the fridge again, and I'll open the fridge again. It's always been a hobby of mine to make collages of my ideal self, and I think that has a lot to do with the diet pills and the dieting. I'm just done dieting. I'm done hiding this behavior.
Psychotherapy, whether in individual or group sessions, can help teach you how to exchange unhealthy habits for healthy ones and reduce binging episodes. Examples of psychotherapy include cognitive behavioral therapy, which was chosen in Joe's case. CBT may help you cope better with issues that can trigger binge eating episodes, such as negative feelings about your body or a depressed mood. It may also give you a better sense of control over your behavior and eating patterns. If you're overweight, you may need weight loss counseling in addition to CBT. Other forms of psychotherapy include group therapy sessions, which is shown in this next clip. A type of group therapy could be dialectical behavior therapy. This form of therapy can help you learn behavioral skills to help you tolerate stress, regulate your emotions, and improve your relationships with others. This can help reduce the desire to binge eat. Another form of group therapy could be interpersonal psychotherapy. Interpersonal psychotherapy focuses on your current relationships with other people. The goal is to improve your interpersonal skills, how you relate to others, including family, friends, and colleagues. This may help reduce binge eating that's triggered by poor relationships and unhealthy communication skills. In some cases, binge eating disorder and depression may exist together, like in Jairo's case. In these circumstances, group therapy may not be enough, and a patient might be referred to a psychiatrist for medical treatment in addition to therapy.
Hi, Jairo. I've gone over your chart, and given your family history, I've decided on several treatment options that we can discuss today. It's my opinion that you would benefit from a combination of psychotherapy and medication. Today we're going to discuss some of those medication options. The first option that I strongly suggest for you are antidepressants, such as an SSRI. An SSRI is a selective serotonin reuptake inhibitor, and it blocks the reuptake of certain neurotransmitters to the brain and helps with the depression issues. Another option is a drug called Topamax. Topamax is an anticonvulsant topiramate, and it's usually used to control seizures, but studies have shown that it is helpful with controlling binge episodes.
These medications may cause people to be confused, irritable, tired, or display other abnormal behaviors. It may also cause some people to have problems with concentrating, suicidal thoughts and tendencies, or to become more depressed. If you or your child or a caregiver notice any of these side effects, tell your doctor or child's doctor right away. Living with an eating disorder is especially difficult because you have to deal with food on a daily basis. Here are some tips to help you cope. Ease up on yourself. Don't buy into your own self-criticism. Identify situations that may trigger destructive eating behavior so you can help develop a plan of action to deal with them. And lastly, get professional help.